of Sister Astridah, what are some of the practical steps that local churches, mosques, Hindu temples can do to persuade and urge our people to get vaccinated in light of the very myths that you've dismantled this in this session? What practical things can we do as local churches, mosques, synagogues, and so on? What can we do as a faith community?
Okay, thank you, Gibster. I think I would like to begin by saying that the first step is show compassion to those who are still struggling to decide what they want to do. And I think this is very important because we are human and it's normal to doubt. You know, now we are towards Christmas and we are in Advent season as Catholics. So we read about John the Baptist preparing the way for the Lord. At one time he doubts and he says to his disciples, go and ask that man, is he actually the one? Because now he's in prison. So he doubts and says, mm-mm. So Jesus says, go and tell him what you see. And so like John, we can be in doubt. It's normal. We can seek clarifying questions. We in the church, like Bishop said, we have experts in the medical field. And these are people actually who are championing the fight against COVID-19. Like I said, churches need to provide timely information and also be able to listen to the people's concerns, because we cannot brush away and say, this is perfect, the vaccine is 100% safe and you don't need to worry. We need to listen to their clarifying questions and be able to respond adequately. So setting up talks around what are vaccines, what is the importance of vaccines, and what type of vaccines are actually available to us, how can they access them? And also being open to have centers where they can actually receive these vaccines. We've seen our own hospitals becoming epicenters, places where they can receive and access the vaccine, which is very good. And we continue being a beacon of hope, even when times that people come for a vaccine, but actually, you know, they don't need the vaccine, they need encouragement. So it's being able to provide the necessary medical services, but also responding to the needs, the spiritual needs of these people. And, you know, sometimes because of this economic pressure, people are going through a lot and they need the church to meet their needs differently. So it's very important as churches, faith-based organizations, to be able to meet our people at their point of need, encourage them to say vaccines will save our lives because we have seen through evidence, like I earlier stated, and they can stay for a longer period of time as opposed to not having a vaccine at all. There are people, I have been vaccinated. I gave example of my sisters in the community. And the funny part is, like Bishop said, you know, because of the stigma, I can have the vaccine. And I've heard it's a reality. Someone, you say, oh, I want to talk about vaccines and encourage others. They say, no, don't say, don't talk about that vaccine. And you look at them and you say, but you have been vaccinated yourself. So you see, I'm seeing that many people are afraid of coming out and say, I've been vaccinated and it's good for me. I believe it will serve me, help me. And so they are afraid because of the stigma that is going on to say, if you talk about the vaccine, you're also antichrist, or, you know, because of this myth and that myth. So let us take courage. Like I said, we might be like John at the moment. We are in doubt, but let us seek clarity from those health practitioners. We can reach out to health facility, get information, read about the reliable sources of information, and be brave and make the right decision.